Welcome back to This is VANCOLOUR. Earlier this month, Premier David Eby announced that the province will expand compassionate involuntary care. That's treatment without consent for people with mental health and addictions issues. This includes opening highly secure facilities, the first two being on prison grounds, to house people detained under BC's Mental Health Act. The Premier also pledged to ensure that youth would receive care when they are unable to seek it themselves. Is this the right course of action? Here to discuss is the former Provincial Health Officer who in 2016 actually declared BC's toxic drug crisis a public health emergency. He's Dr. Perry Kendall, and this conversation is brought to you by Pacific Sands Beach Resort in Tofino, laid-back luxury, as beachfront as it gets. Dr. Kendall, Premier David Eby and the BC NDP say that some people with addictions challenges, brain injuries, and mental health issues need direct intervention and care without consent. Their main political opposition, the BC Conservatives, also agree with that. What's the evidence that involuntary care is the right course of action?
I think it depends very much on which group of people you're looking at and what kind of care you're offering. I mean, there are certainly individuals in all of our town centres who are homeless, living on the street, obviously have severe psychiatric unmet needs, and are substance users as well. I think those people actually need a sanctuary. There must be a better way for those people to live than on the streets, being beaten up, being robbed, being hassled. And the only way they're bothering anybody is the fact that they're there looking strange and weird. So I think they should have a sanctuary. A sanctuary should be made available for them. I'm sure if it was nice enough, they'd go there. There's also a smaller group, I think, on the streets who have all of the above symptoms, but they're quite violent offenders and scary people. They're preying on other victims there. And I think that the courts and jail time with compulsory treatment added to it may be a really good solution for that very small group. Beyond that, I'm not sure that there's much evidence that secure care, no matter how compassionate, is effective compared with having good access to voluntary treatments that actually work, that are geared towards the individual. And we have a chronic lack of that at the present time.
The Premier is often given this example of someone who is admitted into the emergency room multiple times a day because of an overdose. Would they not benefit from compulsory involuntary care?
Well, that's probably going to involve a certain amount of withdrawal management, getting people away from those drugs, and at some point they're going to come back into the community. And the data on that is that they're much higher risk of a toxic drug overdose and death than people who haven't actually been admitted to compulsory care. So the evidence on that isn't particularly good. And what I think is even worse, I mean, many thousands of people are admitted for short-term stabilization and detoxification. But we have no idea for whom it is working or what works best or what the outcomes for or what the best treatment is. So there's a real lack of evaluation of our current circumstances. And we do know that voluntary access, easy access, swift access to evidence-based treatment is insufficient to meet the demands that are currently there.
Does that surprise you that in a system where voluntary care, where someone puts up their hand and says, hey, I want addictions treatment, where that system is not readily available for people, the province and the opposition party are talking about involuntary care?
I think it's primarily the opposition party talking about involuntary care. And I think that's a bit of a knee-jerk magic thinking reaction to people who are claiming that we don't have enough public safety on the streets, that we want to move these people somewhere. And the temporary solution has always been to move them somewhere else and not have them in my backyard. And it's been a long time building homelessness. The drugs have gotten worse and worse. The income standards are inadequate. We don't have nearly enough supportive housing. And I think it's a foolish notion that we can suddenly magically put people into treatment. They'll come out, they'll be whole, they won't want to go back to drugs again. Maybe if they're lucky, they can get a job. Maybe if they're lucky, they can find a place to live. But for most people, I think we'll just be sending them back to the same intolerable circumstances that they were trying to escape in the first place.
Now, as you're aware, there are over 20,000 people in this province who are already in involuntary care. In fact, that number doubled over the last 15 years. From your understanding, with this proposed expansion, what is the difference here? What is the province saying in terms of how they're expanding this program?
Well, again, it depends on the group. I mean, I think if you're talking about that very small group that I first managed, who actually need a sanctuary, a safe place to be where they can access treatment, they can access nutritious foods, they can sleep in comfort at night without worrying about being beaten up or rousted out, then maybe a sanctuary for those people, why would they choose to leave it if what they need is there? And if we could get adequate outreach psychiatric mental health programming for others, and if we could find them a safe place to live, a roof over their heads and 3 meals a day, they may do very well under that, even if they still use drugs. They won't be driven to desperate measures. But the more we move outside of that small group, the less evidence we have. And as you say, 20,000 people may have been admitted temporarily for assessment. But I don't know of any publications that suggest for who it worked, and when it didn't work. There's clearly evidence that for some people it is harmful. They have a higher death rate after they've been taken off their drugs. And for youth, there can be a lot of problems and stress, fear of going for help, fear of the authorities, and fear of healthcare.
And I want to touch on youth. We have about a minute left here. When it comes to youth, is there a different approach compared to adults that would work?
I don't know. I mean, the highest risk group are currently under the care of the Ministry of Children and Families, and they currently have the worst outcomes for youth across the board. There are other youth who are taking drugs. Obviously, it's something that's a risky period. People do that. I deeply sympathize with parents who are worried about that. But again, I would really like to see the evidence. It obviously will work for some kids, but which kids? Can we target it to the kids it would work for? And can we come up with other programs for the kids for whom it doesn't work, for whom it makes life worse?
Dr. Kendall, I appreciate your expertise, and I appreciate you taking the time to talk to me tonight. Thank you so much.
Thank you for the opportunity.
Folks, that was former Provincial Health Officer Dr. Perry Kendall. Thank you so much to Pacific Sands Beach Resort in Tofino for supporting local conversations, even when they're uncomfortable. Now, after some business, can you espouse common sense while saying it's healthy to question everything? Some politicians think you can. So let's talk about it up next.